Secretary Clinton, the Department of Health and Human Services says more than 17 million Americans who are not insured now have health coverage because of Obamacare. But for Americans who already had health insurance, the cost has gone up 27% in the last 5 years. While deductibles are up 67%, health care costs are rising faster than many Americans can manage. What's broken in Obamacare that needs to be fixed right now, and what would you do to fix it?
Well, I would certainly build on the successes of the Affordable Care Act and work to fix some of the glitches that you just referenced. Number one, we do have more people who have access to health care. We have ended the terrible situation that people with pre-existing conditions were faced with, where they couldn't find at any affordable price health care. Women are not charged more than men any longer for our health insurance, and we keep young people on our policies until they turn 26. Those are all really positive developments. But out-of-pocket costs have gone up too much, and prescription drug costs have gone through the roof. And so what I have proposed, number one, is a $5,000 tax credit to help people who have very large out-of-pocket costs be able to afford those. Number two, I want Medicare to be able to negotiate for lower drug prices, just like they negotiate with other countries' health systems. We end up paying the highest prices in the world. And I want us to be absolutely clear about making sure the insurance companies in the private employer policy arena, as well as in the Affordable Care exchanges, are properly regulated so that we are not being gamed. And I think that's an important point to make, because I'm going through and analyzing the points you were making, Martha. We don't have enough competition, and we don't have enough oversight of what the insurance companies are charging everybody right now.
But you did say those were glitches.
Yes.
Just glitches?
Well, they're glitches because
27% in the last 5 years, deductibles up 67%?
It is, because part of this is the startup challenges that this system is facing. We have fought as Democrats for decades to get a health care plan. I know, I've got the scars to show from the effort back in the early 90s. We want to build on it and fix it, and I am confident we can do that. And it will have effects in the private market. And one of the reasons in some states why the percentage cost has gone up so much is because governors there would not extend Medicaid. And so people are still going to get health care, thankfully, in emergency rooms, in hospitals. Those costs are then added to the overall cost, which does increase the insurance premiums for people in the private system.
I was on the committee.
Senator Sanders, I want you to respond to what she was saying, but you're instead calling for single-payer health care.
Exactly.
Note people won't have to pay deductibles or premiums, but they will have to pay new taxes.
Yes.
Can you tell us specifically how much people will be expected to pay?
Let me say this. As a member of the Health Education Committee that helped write the Affordable Care Act, much of what Secretary Clinton said about what we have done, among other things, ending the obscenity of this pre-existing situation, is a step forward. 17 million more people have health care. It is a step forward. But this is what we also have to say. Not only are deductibles rising, 29 million Americans still have no health insurance, and millions of people can't afford to go to the doctor. Major crisis in primary health care. Here is the bottom line. Why is it that the United States of America today is the only major country on earth that does not guarantee health care to all people as a right? Why is it that we spend almost 3 times per capita as to what they spend in the UK, 50% more than what they pay in France, countries that guarantee health care to all of their people and in many cases have better health care outcomes? Bottom line, this ties into campaign finance reform. The insurance companies, the drug companies are bribing the United States Congress. We need to pass a Medicare for all single-payer system. It will lower the cost of health care for a middle-class family by thousands of dollars a year.
Senator Sanders, you didn't really tell us specifically how much people will be expected to pay.
But they will not be paying, Martha, any private insurance. So it's unfair to say in total.
But you can't tell us a specific number.
I can tell you that adding up the
roughly.
fact that you are not paying any private insurance, businesses are not paying any private insurance, the average middle-class family will be saving thousands of dollars a year.